Did you know that prostate cancer is a major threat to men's health worldwide? Over 1.4 million new cases are diagnosed each year. Yet many men ignore the warning signs, which could make the difference between an early diagnosis and serious complications. There is a widespread belief that prostate cancer only affects older men, but the reality is different. This disease can develop silently with no obvious symptoms in the early stages. And when the signs begin to appear, many underestimate them. In today's video, I'll reveal everything you need to know, from hidden symptoms to the risk factors, up to the most effective prevention strategies. And there is an amazing story I want to share with you. A man who ignored the signs and took a big risk. But with just one choice, he changed his destiny. Watch until the end to discover the most surprising detail that could save your life. And if you want to support the spread of vital information, leave a like, subscribe to the channel, and write in the comments, "Health first." The prostate. A small organ, a great role. The prostate is a small gland located below the bladder and in front of the rectum. Even though it is the size of a walnut, its role is fundamental. Produces the fluid that nourishes and protects the sperm. But what happens when this gland undergoes alterations? Inflammation, prostatitis, benign enlargement, benign prostatic hyperplasia, and in the worst cases, cancer, can trigger annoying symptoms and in the most serious cases seriously compromise your health. Prostate cancer develops when cells in this gland begin to grow uncontrollably. It often progresses slowly, but in some cases it can become aggressive and spread to other organs such as the bones and lymph nodes. Why early diagnosis makes the difference. Detecting prostate cancer in its early stages can increase your chances of survival to more than 90%. The problem? Many men avoid screening out of fear or shame. The main tests for early diagnosis are PSA, prostate-specific antigen, test, a simple blood test that detects abnormalities in the prostate. Digital rectal examination, DRE, a quick check to detect any irregularities in the prostate gland. Yet many men put off these checkups, exposing themselves to unnecessary risks. Remember, your health is worth more than any embarrassment. Risk factors. Are you in danger? Prostate cancer doesn't strike by chance. Some factors significantly increase the risk. Age. After age 50, the risk increases exponentially. Family history. If a close relative has had this disease, the risk doubles or triples. Ethnicity. Men of African origin have a higher risk in more aggressive forms. Diet and lifestyle. A diet rich in saturated fats, a sedentary lifestyle, and obesity promote the growth of tumor cells. 7 signs you shouldn't ignore. 1. Changes in urinary flow. If you have trouble starting urination, or your flow is weak or intermittent, you may have a prostate problem. This symptom is often associated with benign prostatic hyperplasia, BPH, but can also be an early sign of cancer. If you notice worsening over time or the need to strain to urinate, see a doctor immediately. Other related signs may include a feeling of incomplete bladder emptying or the inability to hold urine for long periods. 2. Frequent urination, especially at night. Getting up several times during the night to urinate, nocturia, may be a sign of an enlarged prostate or cancer. This symptom can interfere with sleep and reduce quality of life. If the frequency suddenly increases, or if you feel an urgent need to urinate even during the day, do not ignore it. The need to urinate in very short intervals, even when you have drunk little fluid, could be a sign of a more serious problem. 3. Blood and urine. or in the sperm. Although it may be due to other causes, the presence of blood could indicate a serious problem with the prostate. Blood in the urine, hematuria, or semen, hematospermia, may result from infections, kidney stones, or tumors. Do not ignore this signal and undergo a specialist examination. Sometimes the blood may not be visible to the naked eye, but only through urine tests. If you notice pink or brown urine, it is essential to seek immediate medical attention. 4. Pain in the pelvic or lower back area. Persistent pain in the lower abdomen, back, or sides may be a sign of advanced cancer. Prostate cancer can spread to the bones, causing chronic pain. If you experience unexplained pain that does not improve with rest, talk to a doctor. Some men may also experience pain during prolonged sitting, or a feeling of pressure in the perineal area, which may be a sign of inflammation or abnormal growth of the prostate. 5. Painful ejaculation or reduced sperm production. If you notice discomfort during ejaculation or a reduction in semen volume, it is a good idea to consult a doctor. Alterations in ejaculatory function may result from inflammation, but also from more serious pathologies such as prostate cancer. Pain during ejaculation may be accompanied by a burning sensation, or a change in the consistency of the seminal fluid, signs that should not be underestimated. 6. Sudden erectile dysfunction. Prostate cancer can affect the nerves and blood vessels involved in erection. If you have trouble maintaining an erection, or if you notice a worsening of sexual function without an obvious cause, it is important to have it checked out. This problem can also result from poor blood circulation, from the use of drugs, or from psychological stress. But if it occurs suddenly, it is a good idea to have a medical checkup. 7. Sudden weight loss and chronic fatigue. Unexplained weight loss or persistent fatigue may be signs of advanced cancer. Weight loss without a diet or an increase in physical activity may indicate an altered metabolism from an underlying pathology. Chronic fatigue can also be linked to an iron deficiency due to internal microhemorrhages. If weight loss is accompanied by a loss of appetite or night sweats, it is advisable to consult a specialist for a thorough diagnosis. A story of hope. Ethan, a 56-year-old man, led an active life and had no particular health problems. However, for a few months, he had noticed frequent urination and slight difficulty emptying his bladder completely. He thought it was just a consequence of age, until one night he woke up with a shooting pain in his lower back. Only then did he decide to get checked out. The verdict? Early prostate cancer. Fortunately, thanks to early diagnosis, it has been possible to successfully treat it with a targeted therapy. Today, Ethan is a living witness to the importance of regular checkups. Prevention. What you can do right now. Do you want to reduce your risk of developing prostate cancer? Here are some effective strategies. Follow a healthy diet. Prefer fruits, vegetables, and whole grains, limiting saturated fats and red meat. Do regular physical activity. Even a daily walk can make a difference. Avoid smoking and excessive alcohol. Both increase the risk of chronic diseases, including cancer. Regular checks. After age 50 or 45 if you have risk factors, get a PSA test and a urological visit. Don't wait. Act now. Your health is in your hands. If you have noticed any of these symptoms, don't delay. A medical checkup can save your life. And remember, prevention is the key to a long, healthy life. If this video was helpful to you, please subscribe to the channel and turn on notifications. Share this information with your loved ones. You might just help them make a decision that will make a difference. to your health.